when I first started my weight loss journey, it was before 2016. I had no success at all. When I tell you everything, like Dr. Venezuela said, it's just, it's hard trying to actually lose pounds. And you call yourself trying to lose actual weight. Sometimes it could just be water weight. Sometimes it could be fecal matter or whatever, but it won't be actual fat. And I went through everything. I actually took a drug called Adipex. I think that's how you say it. That had bad complication. It actually had a reverse side effect, and another side effect, PCOS, which in females, you produce another hormone that increases your weight. So on top of PCOS and other things, I wasn't fertile. I just kept getting bigger and bigger. And then they put me on a steroid for breathing. That increased my weight. So I was struggling so bad to lose weight that nothing was happening. So I saw on the internet, I saw another young lady, I forgot her name. Her name is, I forgot her name. She does, she's on YouTube, it's VSG Track. She had a surgery with Dr. Venezuela before I did, and I had messaged her on YouTube, and she also gave me her Facebook and her email. And when I tell you, that helped me be so comfortable with Dr. Venezuela, and when I did the reviews, I saw like she was the best out of everybody like that I knew of that had the surgery before. So I was like, you know what, I'm gonna give this a shot. I'm gonna actually go get the surgery. And when I tell you, when I first started my, because I talked to Prudence Tickner, which is the dietitian, the nutritionist at NBC, she said, no, you don't have to do too much. And I'm sitting there like, I'm on it. She said, where are you now? I'm on the treadmill. She said, you calling me and you're on the treadmill? I was like, yeah. She said, you don't have to do all that. She was like, just relax and everything, and make sure you take the proper precautions before surgery. I had to stop, just like the gentleman said, certain medications because it will interfere with surgery. So I'm just getting ready, getting prepared. I took protein shakes. I also took I think it was called probiotics. I took my probiotics. I was already down 45 pounds, and guess what? That was in 8 weeks. 45 pounds. Most of that probably was like liquids or whatever, but I felt so good, and I felt the stress come off my knees. I barely was walking at work. I couldn't barely stand for hours because I had to stand. I'm a security guard, so I had to stand 8 hours on a job, and then sometimes 12 hours, you know, so I couldn't stand that much. So someone said, well, I think you should continue and go on with this. So I said, okay. I said to myself, I said, God, I said, I've been trying. I knew this right for me, and I felt it. As soon as I got there, they do the pre-op testing. They check your blood pressure and blood sugar and everything. And then when I did, when I went into, I think the clinic, like you have to sign and register. I got there 2 days earlier, so I went shopping, which was beautiful. And I talked to Dr. Louisiana. Other people was going for their surgery. I got a chance to meet her, and I think she was like on a coffee break or something. So she was talking to me, and you don't get this nowhere. She actually sat with me and gave me a hug and a kiss and prayed with me, like before my surgery. Like nobody else do that. Like, and I felt like this could be like somebody related to me. Like she just was so sweet, open arms, and she explained everything, the precautions, everything that I had to do as far as after surgery and before surgery. So I felt real good and very comfortable before my surgery date. The day that I had to go in, I was first patient that she seen that had to be operated on. I got up at 4 o'clock in the morning, and here come Jesus. You ready, Sheila? You ready? They said, come on. And I went downstairs. Oh, I'm so tired. He said, come on, it's a happy day. It's gonna change your life. I said, okay. I'm just still kind of tired because I didn't sleep too at night, because I was like, oh, I wish I had this or I had that. And it was like, you're doing so much. It's gonna be fine. So actually, I got to the hospital. They put the compression garments on you. I believe that I got a pill or something like that. And then they send you into the next room, and they rolled me in there. And they were laughing because I was talking, and I'm not sure if you get an injection, you have to lay back on a table. And they was like, we're gonna come back, and I was still talking, and they just started. I just saw them smiling. The last thing when I blacked out, I was like, I see you smile, sound like angels. And then after that, I woke up. Then again, I started talking again, and there was a nurse. He was doing something. He said, "You all right, Miss Dominique?" Like that, and I was moving, wiggling my toes, and he was like, "What you doing? What you doing there?" And then I was like, I said something about TV. He said, "Well, there's no TV on right now," and you're out of it after the surgery. I don't remember how I got to my room. I'm more than sure I probably got wheeled there. When I woke up, I saw a lady that was, and God bless her, I saw a lady who was a patient's mom. She tucked me in. She was like, "Oh, I don't think you're supposed to get up, honey." So other people do look out for you while you're there. And you actually feel really good and comfortable. The people that's there, that's the other patients, make you feel comfortable as well. So after that, I didn't feel like nauseated, but like the Gatorade, the sugar, I don't know, I wasn't used to it, but they tell you have to be hydrated. Ice chips, water, and Gatorade. But I didn't really like the Gatorade. I just drank it, kind of cut it with water. I had to walk around because I had like really bad gas, but that comes with after surgery. So they make sure, the nurses, when they come in, they change everything, they clean everything, they looked at my wounds. Now the drain that I had, it was right there, but I guess that was causing some of the gas too, because it was kind of like irritating, but it wasn't painful. Then the next day they took it out. That didn't hurt. Some people say it do. I wasn't in pain. After that, I got my drain taken out. They bring you actually downstairs. I think it's downstairs. You get X-ray leak tests, and you drink this solution, and you can see actually what they done. And I'm like, "Oh, that's me now. It's like a skinny banana." And then they started laughing, and that was about it. But you have to maintain it. You have to say this is a lifestyle change, and you have to be. I'm sorry, y'all. I'm sorry. You just have to be prepared for this, and it's emotional because, I really love you. I really love you. I'm sorry. Thank y'all.